Hello, welcome back to day 2. And if there are some of you here who could not attend yesterday, welcome to you as well. My name is Wandy Hernandez Gordon, and I am the chair, and I welcome you on behalf of the entire organization. We hope you had a good rest and were able to digest all, or at least most of the good information that was shared yesterday. Today is designed to help you meet new people and learn new information just as yesterday. Today is the time for you to exchange contact information and learn from each other in ways you can improve the work you do in your respective communities. Now, ladies and gentlemen, now that I said my welcome, I would like to give some much deserved recognition to a gentleman who we sometimes call behind his back the OG of CHWs. Next slide, please. He has been a CHW all of his life, but we can trace him professionally back to 1991. That's 30 years ago, y'all. When he was working with the Boston Street Youth Outreach Program in Boston, Massachusetts as a CHW, he was with the Unity before the beginning of Unity and has not missed a session since the first meeting. Of course, he sits on several other national boards like the American Public Health Association, but more importantly, I want you to know that he has been fighting for CHWs all of his adult life. He was one of the founders of the American Association of Community Health Workers, and even though it didn't last, he kept working and was a founder of NACHW. He helped to get a CHW SPIG at APHA, American Public Health Association. He helped to get the US Labor Department to give us a classification as the community health workers. There is not enough time in this day, ladies and gentlemen, to give him the recognition he well deserves. The board did privately recognize him with a plaque, but we would be remiss if we did not give him a moment of this conference, because he does deserve that. Yesterday was the last day of his term on this board, and he will truly be missed. Darrell, we really appreciate all of the work that you have done and will continue to do for us. We love you, hermano mío, and we thank you. Please help me in giving Darrell Fox a round of applause. Ladies and gentlemen, Darrell Fox, thank you, thank you. And now let's keep this show on the road, shall we? Right now, I would like to actually pass it along to Aurora Grant Wingate. Thank you.
Thank you so much, Wandy. Hello, everyone, and thank you once again for joining us here today. My name is Aurora Grant Wingate, and I am NACHW's Member and Partner Engagement Coordinator. I joined the team just last October, and I'm so excited to not only get to attend my first Unity conference, but get to present as well. I have the great pleasure and honor today of getting to announce our award winners. For 2021, NACHW is proud to honor CHWs who we feel have exemplified our mission to unify the voices of community health workers and strengthen the profession's capacity to promote healthy communities. Today, we want to celebrate and recognize those CHWs who embody our organizational values of self-empowerment, social justice, equality, self-determination, dignity, respect, unity, and integrity. And before we go on, each of our winners, a member of our team, will be reaching out shortly to coordinate sending you a gift. For our first award is the Care in COVID Award. This award goes to honoring a CHW who went above and beyond for COVID-related community support during the pandemic. The winner of the Care in COVID Award is Carla Alvarado from Bayer Scott and White Health, who is a CHW Navigation Manager in Arlington, Texas. Carla has been a CHW for 9 years. The person that nominated Carla wrote that during COVID, Carla organized a drive for needed household items such as hand soap, paper towels, toilet paper, and toiletries for underserved patients that had difficulty getting to the store, didn't have the means, or who were too afraid to venture out during COVID. She inspired not only her CHW navigation team to contribute, but staff all across 7 Bayer community care clinics. She drove her personal vehicle to staff homes, grocery stores across multiple cities, and more to pick up the supplies. Boxes and bags were put together by Carla and her children. She even helped to do both porch drop-offs as well as coordinate pickups for patients that needed the household goods. Thank you so much, Carla, for your dedication and leadership during these times. Our next award is the Hope in Healthcare Award, which honors a CHW demonstrating exemplary work to achieving health equity. The 2020 Hope in Healthcare Award winner is Brianna Wills. Brianna works for Young Queens in Training, Inc. as the CEO and founder. She has been a CHW for 5 years. One of her nominators wrote that Brianna is an exemplary pillar in our community. Her tireless efforts to empower youth and to help our community through fundraisers, food drives, and community givebacks. Much of her efforts come from her own resources, and as a single mother, that is a truly selfless act. She has tremendously impacted the lives of her youth in her program, and many who have moved away or have gone on to other avenues in life still stay in touch with her and thank her for what she has done to change their lives. The nominator wrote that she would be considered to be the change you want to see in your community. She deserves all the awards and accolades possible. She is the most personable, humble spirit that she has had the pleasure of getting to experience. Congratulations, Brianna, and thank you so much for your exemplary service to your community and for the leadership and spirit you bring to the CHW profession. Our next award is the Equity and Justice Visionary Award, honoring a CHW who has made strides in the advancement of racial equity and social justice. The 2020 Equity and Justice Visionary Award winner is Yemeni Zelvala. Yemeni works at Comunidades Unidas, as a CHW program director in West Valley City, Utah. I'm going to read a segment of her nomination form. This person says she nominated Yemeni not because she wants recognition, but because she is the total opposite. She works in silence except for when she's speaking up for others. Her actions are definitely much louder than her words. She deserves this award because she is someone who is receiving any recognition, and she will refer it to her CHWs and her other partners. She truly is an amazing person and has been very active and engaged in the fight in Utah in achieving health equity for all, as well as being one of the first responders in the pandemic. I can't even believe to share all that she has done through her organization to ensure that all CHWs are equipped to serve community members and are receiving the resources that they not only deserve, but should automatically have the rights to. Congratulations and thank you, Yemeni, for your work and leadership, as well as your compassion during this past year. The final award I will be presenting today is the Lifetime Achievement Award, honoring a longtime career professional CHW who has served her community for over 20 years and celebrates the impact she has made on her community. This award winner is Jessiana Marquez, also known as Auntie Jessie. Auntie Jessie is the Executive Director of Kau Rural Health Community Association, Inc. in Bahala, Hawaii. She has spent 23 years as a CHW. Her nominator wrote that Auntie Jessie has been a humble community health worker, leader, mentor, educator, and advocate to youth, elders, family in our rural, underserved, and vulnerable minority populations over the past over 20 years. She has worked tirelessly with very limited financial and human resources while being the caregiver of her husband with cancer and cardiovascular disease and with a daughter on dialysis. She maintained health education resource opportunities and workforce development programs and took the leadership in COVID-19 mitigation, outreach, education, and coordination vaccine testing and vaccine clinics. As a CHW advocate, she works with legislators, educators, healthcare providers, community-based organizations, CHWs at the local, state, and national levels to raise awareness and investments in CHW certification programs, workforce development, and training. Congratulations and thank you so much, Auntie Jessie, for everything you have done, are doing, and will do for your community and for all other community health workers. We thank you for your leadership, mentorship, and the passion you bring to your work. Now I would like to pass it on to Lisa Renee Holderby Fox, daughter of Esther M. Holderby and a member of NACHW's Board of Directors. Thank you so much.
Thank you, everyone. Thank you very much, Aurora. Before I say anything else, I just want to congratulate all of the award winners, and particularly, I want to congratulate Auntie Jessie. I had the pleasure of spending some time with her a few years ago when I was in Hawaii, and it just does my heart good to see that she is being recognized for her work. Next slide, please. So, I am standing here at this moment as the chair of the, or co-chair of the nominations committee. And I know that folks thought that we were done with that portion of Unity yesterday, but we were not. The nominating committee feels that it's very important to make sure that all of the newly elected members are welcomed appropriately to the board. And as part of that, we have an induction ceremony that many of you were able to view yesterday. Unfortunately, sometimes technology does not work the way we hope it will, and that was the case yesterday. Yesterday, you may have noticed that one of our newly elected board members did not participate in the induction ceremony. You guessed it, it was an issue with technology. However, we feel really strongly that it's important to have this ritual to make sure that we're welcoming everyone who's been elected. And so with that, Lily Fox of South Carolina will have her very own induction ceremony. So if I could now ask Wandy and Lily to please turn on their cameras. All yours, Wandy.
All righty, Lily. All right, so Lily, we're going to do the NACHW pledge. So I would need you to actually repeat after me, but please raise your right hand. I, your name,
I, Lily Fox,
do solemnly pledge
do solemnly pledge
my commitment to the National Association of Community Health Workers.
my commitment to the National Community Health Workers Association.
I pledge to give my time,
I pledge to give my time,
energy, and resources
energy, and resources
available to me
available to me
and appropriately beneficial
and appropriately beneficial
to the forward movement
to the forward movement
of this association.
of this association.
I furtherly pledge
I furtherly pledge
that I fully believe in
I fully believe in
and will support
and will support
the mission and values
the mission and values
of the National Association of Community Health Workers.
of the mission of the National Association.
That's fine. I will uphold
I will uphold
my duties as a member
my duties as a member
of the Board of Directors
of the Board of Directors
committed to the call
committed to the call
of community health workers.
of community health workers.
All right, Lily. I would like to add, you do have the pin light?
I do.
Okay. I would like to add that light to the others that were shining yesterday. And so I would like you to say this with me in unison, or maybe I can actually say it and you can repeat it. Is that okay?
Okay.
All right. I add my light to the torch,
I add my light to the torch,
helping to illuminate the path
helping to illuminate the path
for community health workers.
for community health workers.
We welcome you, Lily Fox,
Thank you.
as a board of directors of the National Association of Community Health Workers. Thank you so much and congratulations.
Thank you.
Yay! Thank you so much, Lily.
Thank you.
All righty. Lisa Renee?
Yes, thank you. Thank you both, Wandy and Lily, for participating in this very, very special induction ceremony. I'm honored that we were able to do this for you, Lily.
Thank you very much.
Thank you.
All right, Lily. Yeah. Okay, thank you.
Thank you. Next slide, please. So it seems a little strange. Just folks, let me just back up for a moment. I'm here now. I'm taking off my nominating committee co-chair hat and putting on the very first hat I have ever worn in my life. And that is the hat to be the daughter of Esther M. Holderby. And it seems a little strange to be here at Unity and not have a recipient of the Esther M. Holderby dedicated, I'm putting that in quotes because it's now extraordinary, CHW award. Unfortunately, there was a glitch which did not allow for complete nominations to be submitted. And the issue was out of the control of the committee and myself, and we would like to offer sincere apologies to anyone who ran into problems trying to submit nominations. And given this, we did not want to shortchange anyone and wanted to make sure that everyone who had a nomination submitted would have an equal opportunity to be the recipient of the award. And so given this, I would really strongly encourage anyone who had submitted a nomination this year to please submit that nomination again next year. I've been assured that we won't run into this glitch again and again. I just want to express my sincere apologies. However, I am not going to dwell on that, and I'm going to use this time to introduce my mother to those of you who didn't know her. I'm hoping to spark some memories for those who did and honor past recipients. Next slide, please. Esther was my mother and a long-time cancer survivor, four-time 25-year cancer survivor. 25 years is a really long time to battle anything. And in 2005, she lost her battle, her last battle. She was very, very private about her health issues until I asked her the $25,000 question. I had been working as a CHW for a large opportunity council in one of their programs. And at the time, the Opportunity Council received a Susan B. Coleman grant to create a CHW program to educate about breast cancer. The program really wanted to hire a CHW who had personal experience with breast cancer. And the director of the program came to me and asked if I happened to know anybody who would be willing to work as a CHW in this program. My response to Susan was maybe. My mother had worked in high tech at the time. And I will say to you, high tech was a term, believe it or not, many years ago. But she hadn't worked for a while due to her health. I approached her. I explained to her that her health would no longer be secret if she really wanted to embark on this new journey. And she surprised me by saying, yes, absolutely. If her journey could help others, she was all in. Well, let me tell you, we went from being private to the world knowing in 60 seconds. My mother was out in the community spreading the word of early detection to anybody who would listen to her. She was on TV. She went to community centers. She was in newspapers. She was on the local radio. She showed up at rallies on behalf of funding cancer prevention programs and education programs. And that wasn't enough for her. One day she came to me. At the time I was doing some work with our legislators in Massachusetts. And she came to me and said she wanted to meet some legislators. She wanted to make sure that people heard what was being needed in the community. And she just didn't want to stop and talk to legislators. She asked me if she could have an introduction to Governor Mitt Romney. Like I knew Governor Romney and I could just knock on his door, but she was convinced that would happen. She was on fire. She joined the Massachusetts Public Health Association and became an advocate on behalf of public health. She became extremely active in our statewide association for CHWs. And I had the honor of presenting with her about the importance of CHWs and funding our programs on many stages, including the Unity stage as a mother and daughter duo. And that's what brings me here today. Unity was one of her favorite places, and she met some of her favorite people by attending Unity. I'd like to share with you very briefly what Unity meant to my mother in her own words. I'm going to read an excerpt from an article that she submitted for the Center for Sustainable Health Outreach newsletter. Sorry about that. And so let me share with you in her words. It was called the 2004 Unity Conference, but it was reminiscent of a family reunion. It was my first nationwide CHW conference, and I waited to board my flight. And I wondered how it would be to coexist for the next several days with almost 300 total strangers. Make that 296 total strangers. She knew 4 CHWs from Massachusetts, and one was me, her daughter, that she would share the podium with for a workshop session. When she arrived at the hotel, I had been standing in the registration line all of 5 minutes when my apprehensions disappeared. I found myself chatting not only with the person in front of me, but the person behind me, and we were carrying on a 3-way conversation. Old acquaintances were being renewed, and the newcomers, such as myself, were welcomed warmly into the fold. It's difficult to express the emotions that ran over me the next 2.5 days. To say it was an intense experience would be putting it mildly. Before Unity 2004, I understood the tremendous undertakings of community health workers on a statewide level. Now I was hearing community voices from the nation, singing the same tune, having the same concerns for communities that we have for communities here locally. What can I say about the workshop sessions? I wish I could have attended them all, but they ran concurrently. I truly realized that CHWs, no matter where we were physically located, are all joined at the hip, determined to get the job done. I cannot close without saying this. What touched me most was the realization that there's no pecking order in the world of community health workers. The experienced CHWs reach out their hands for newcomers and willingly share their knowledge, which enables us all to grow. This kind of unity makes us powerful, and we bring that to the communities we serve. I truly believe If the word love could ever be redefined, love would then be under C for community health worker. What impressed me most about the Unity Conference? I came, I learned, I felt the love. This is why the Esther M. Holderby Award is given every year at Unity. And so I'd like to just kind of close out this session, this part of the session, by honoring all of the CHWs who have been past recipients. Whew. And I know that some of them are no longer with us, but it's still really important to honor the work that they've done. So bear with me while I read off several names. Martha Byler from Ohio, 2006. Anita Buell, Minnesota, 2007. Milton Franco, Massachusetts, 2008. Martha Ramirez, Florida, 2009. Corinne Justin, Arizona, 2010. Maria Lopez, Oregon, 2011. Ezekiel Lopes, Massachusetts, 2012. Ron Sanders, California, 2014. Z. Turner, Maryland, also 2014. She was awarded this award posthumously. Linda Medrano, from Texas in 2015. Terry Price, Michigan, 2016. Naomi Cottums, Arizona, 2017. And Wanda Castillo, 2019, from New Hampshire. I want to congratulate you all again. I know that you continue to do amazing work, and you are more than deserving of this recognition during your Unity 2021. Thank you. I'd like to now take a moment to remind you to please nominate your peers for these awards in the future, and in particularly to please consider a peer for the Esther M. Extraordinary CHW Award. And with that, I would like to take a moment and let you know that our keynote speaker will now be introduced. Ramona, please take it away. Next slide, please.
I had the awesome privilege of meeting you many years ago, but unfortunately was not able to meet her. But thank you so much for sharing that information. And I look forward to submitting some names of CHRs that I know that really are deserving of that kind of an award. So good afternoon, everyone. Glad you could be with us this afternoon. My name is Ramona Dillard, and I am the Director of the Community Health and Wellness Program for the Pueblo of Laguna tribal government. And I'm here this afternoon to have the awesome opportunity and awesome honor and privilege of introducing Miss Michelle Archuletta. And I want to take a minute, though, to just ask all of you that are joining us today, how many of you have heard of CHRs or know what community health representatives are? Well, if you haven't, this afternoon, you're going to learn a lot about what CHRs are, who they are, and what they do. Sometimes we jokingly say that they are the grandmas of community health work because CHRs have been around a very long time. We also consider ourselves sisters to community health workers, and indeed, some CHRs are community health workers, all the same, working for the community. So today, I'm going to introduce Ms. Michelle Archuletta, who is a key component of the Indian Health Service, working on behalf of and supporting CHRs in tribal communities. Michelle Teresa Archuletta serves as a public health advisor with the Division of Clinical and Community Services in the Indian Health Services. She is currently the National Consultant for the Community Health Representative Program. Michelle has an extensive background in health promotion, health coaching, and community-based programming spanning over 20 years at the regional and national level. Prior to her work in public health, Michelle worked in the field of sports recreation and physical education at the collegiate level. So she's done a lot of great things in community for tribes. More about Michelle. Michelle is a Mima, and she's an enrolled member of the Lone Pine Paiute Shoshone tribe. She is a warrior for the human spirit. Her studied leadership and change at Antioch University, and sees her current work as her right work for improving community health and well-being. And I have to say that over these past few weeks talking with Michelle, I've come to know her a lot more, and I really do believe and know that she is a champion of the community health representatives and someone that we can go to support us as things go forward in our own tribal communities. So without further ado, I'd like to introduce and welcome Miss Michelle Teresa Archuletta.
Oh, thank you, Ramona. Let's see. It's a pleasure to be here. I'm kind of multitasking with my screen. I'm doing some technical sharing. I'm sorry. People can see. I do want to just say, before I start, it is a pleasure to be here. I am so honored, Ramona, to have come across your path. And I so appreciate the work that you have been doing with the Laguna Pueblos. It's so important. You've been a leader in the field for our CHRs. Your impact is evident. I also want to say I was touched from our previous speaker, presenters, just the heartfelt, I would say, emotion around the type of work that community health workers have with the impact, just being a part of communities, families. I resonate towards that. And I think that that is so empowering for the field. And what's special about all of you as CHWs, CHRs, promotoras is that that is your work. You are working in those communities, walking the walk, being with neighbors to impact health, support, be a resource. You are champions, you are warriors out in the field. So with that, I am going to try to share my screen, okay? And I'm not so sure. Oh, I hope I don't say a cuss word accidentally. Let's see, I might need some help. Show application. I am
Doing great,
going,
Michelle.
am I? Okay.
Yep, there
And
you
then
go.
just go ahead and click slideshow from beginning.
Okay. Is it on?
It's on. We see it from beginning.
Okay, yay, we did this from beginning, yay. Okay. This is stressful dealing with technology, and man, it's a learning curve for all of us. So for those of you who do this every day, my hat's off to you, because boy, it is something. So now with that, I want to just say, yes, I am, as Ramona said, I have a really, I would say, special role with the Indian Health Service. And it is an honor to sit in this role, be in this role, serve in the role as the community health representative consultant for Indian Health Service. And it's not something that I aspired to. It just kind of happened. But when I look back, and I'm going to show you a little bit about me, that this is sometimes what happens with us. You know, we have these opportunities in life. And I say, move into those opportunities, go forward. You never know what's going to happen and where you're going to be led. And so for me, I love sport. That's really how I maybe moved through my teenage years into my college years, I was a tennis player. And so you see this, these are just pictures that I decided to share with the group here because it tells a story. And that's really what I see with Unity is you all have these stories that you have within your communities. You have your own narrative, your own personal story, how you moved into the roles and the work that you are doing on behalf of CHWs, promotoras, CHRs. Well, for me, I love to hit and play the game of tennis. So, you know, I went to college, I played collegiate tennis, I went on to coach at a university, I studied real hard, and I went for certification as a teaching pro. So these are things that when you're really passionate about this work, that's what you want to do. You want to be the best. And so, you know, life changes. And so what happened to me is, as my life did change after that tennis career, I found myself in Indian country. And so this is where I really was able to connect in community health. And so it really was around health promotion, community health, health education. And this is where we worked in the Tuba City service area, which is in northern Arizona. And we led these very exciting community events around wellness, physical activity. And so that's one of our events. It's called a Just Move It event. It started 20 years ago across Indian country, and it's just grown. And so you see this picture. I love this picture. I mean, this is really, to me, what it is out in Indian country, you know, working to affect change. You see grandmas out there in traditional attire, grandpas, aunties, uncles, young ones. We just really focused on families and communities. And one of the big things in my own work in Indian country, and I didn't know it at the time, was working with the CHR program in Tuba City. And I didn't know that 20 years later, I'm going to be sitting here sharing a story, reminiscing and reflecting on a time that really laid and set in motion my path. And so this is the Tuba City CHRs down here on the bottom right. They're a fabulous group of women. And when I started to connect to the CHRs and we started to form partnerships around programs and services, I was really amazed because I didn't have that type of experience when I was coming up through my own younger years. We didn't have CHRs. And so I really didn't even know what that was. And so when I look at this picture, I see that lived experience, I see passion, I see themselves supporting and empowering their loved ones, and not only from a cultural way, but as a way, I would say, with culture that connects culture and health. And so I love this picture in the middle. I grabbed that from one of our CHR modules, and this is really one of the very early CHRs. And the CHR program actually celebrated its 50th anniversary in 2018. So we're 53 years old this year. And so this is one of the very early CHRs going out into communities with the home visit, with health services. And so to me, I look at this and I'm going, wow. And so if you've ever been out to Indian country, you know it's just beautiful. You know that it's still, I would say, raw in terms of the landscape. It's natural. And so I just had to put in, you know, these sheep. And this is from the Monument Valley. And this is, if you ever get a chance, come through the Southwest and up into the Montana area. You'll see, and the Oregon, Washington. You'll see over in Minnesota, this Northwest range. You'll see Indian country. Of course, Indian country, is very large in terms of Native people having place within the United States, but you'll know it when you come into it. And then one of the other things I do want to say is very empowering for me is this opportunity to be in healthcare. And I didn't start out that way, as you have heard me say. My path was through sport and recreation and physical education. And so this picture on the left really is thinking and being a part of what it takes to collaborate, to be different, to work alongside others who have different lived experiences. And so I was really, and I love about the community health worker field is this community development, this advocacy component. And I see this being played out right here. And learning how to, when you're working within different communities, it is a gift, and it is learning, and it is a lot listening. So sometimes that means we have to take off that subject matter expert hat, because we're no longer the subject matter expert when we move into communities, if we come from the outside. And that is something that I had to learn myself. So I'm going to advance and go to the next slide. All right. So this is, I think this slide has a lot of importance to me when I look at it, because I see it full of this community health worker energy that I see NACHW, all of the advocates that are in the audience, the researchers, the academics, the community health worker associations. You all have inspired all of us. You're moving us, you're nudging us, you're taking us down into this place that is sometimes kind of, I would say, foreign in a way, but we're going with you as CHRs. And so I see this as a lot of collaboration, a lot of partnership, a lot of energy. And so you can see this. And what I love about over on the right-hand side is claiming and empowering identity of the CHW field in terms of knowing how you impact the field. And so you can see this. I did use quite a few of the nuggets of work that have been talked about, that have been published to help shape who we are as CHRs. And so if you go on our website, you will see these two new infographics. That's just only one little piece of it. But this is, this resonates with all of us in healthcare, especially as CHRs, with outreach, community education, that informal counseling, social support advocacy. So I want to say thank you to all of you who have moved us in that direction. So let's see, continuing on, I see this, this is just a little slide that gives you an overview. I'm happy to share this presentation with you if you would like it. But this is a little bit of a background, as Ramona said. I thought about how many people know about the CHRs? How many people know about the Indian Health Service? Thinking about the impact in tribal communities with COVID-19, what that means for Indigenous nations. Sharing with you how CHRs responded during COVID-19. We're going to talk a little bit about that. A little bit is going to also be around IHS vaccination efforts. And we have a real success story about that will come out. What's in the hopper around strengthening tribal communities with CHRs, and where are we going as CHRs? So this is really what this presentation is going to be about. And so just, briefly, I'm not going to spend a whole lot of time on this part, but briefly, we are under the Indian Health Service. We're an agency that is within the Department of Health and Human Services. We're a health service delivery system. That is what Indian Health Service is. And we provide care and treatment, health services to tribes, to urban health programs providing care to American Indians, and to we call them service units to existing IHS healthcare hospitals. But when it's all said and done, we are working across 37 states, and we have 574 federally recognized tribes that are spread across these 37 states. And so you can click on any one of these hyperlinks to take you to more, I would say, information around the Indian Health Service. But that's really kind of what I wanted to highlight. But also the other thing is this mission of the Indian Health Service. And I really like this mission. It's not over the top. It's simply to raise the health status of the American Indians and the Alaska Native people to the highest possible level. And that means that we all have a part, we all have a role with this.
Dr. Archuletta, I apologize for the interruption. Could we screen share one more time? There's a optimization that needs to be done to showcase the full slide.
Oh, okay. Tell me what I need to do.
If you would exit out of the PowerPoint slide share for just a moment and show and share.
Okay, so stop showing application.
Okay, and then let's republish.
Show application?
Yes. All right, so here what we're gonna do is, looks like the setup is updating, okay. Let's go back to the PowerPoint slide. And so it's cut off on half of it. So I wonder if
right
we
here?
could, yes, perfect, right there.
Did I do it?
You did it, it was all you. Thank you, Dr. Archuletta, that was brilliant.
Oh no, gosh, should I start over? No, I'm just kidding. Okay, thank you, I appreciate that. Just jump in anytime if you need to, we're gonna move forward. Okay, so all of this slide is really a large picture image of what the Indian Health Service and how it's broken up in terms of regional areas. So as an example, I told you I went to work 20 years ago and I supported the Navajo area Indian Health Service. So at the bottom, right below Arizona, you see the word Navajo, and you follow that line, and that kind of an ovalish area is the Navajo area Indian Health Service. From there, I went to the Bemidji area. So if you go up to the top right, you will see the word Bemidji, and that is the 3 states, Minnesota, Wisconsin, and Michigan. So you'll see that's the area that I then worked across tribes. And so we had 34 tribes up there that really expanded my knowledge of another region in terms of how tribes provided care, primary prevention programs, health education. So this is just sharing with you. You have tribal CHR program partners that are probably within your area. So if you're from Portland or Oregon, they're in this area. And so one of our goals is to try to help support and foster those types of connections. But this is just simply an at a glance. As you can see, this is how we in the Indian Health Service kind of section out these areas, okay? So now what happens is I have really a tremendous opportunity to have a CHR area consultant in each of these individual areas that in turn helps support the CHR field. And so that is a way that within the Indian Health Service, we are able to work from the headquarters level, and the headquarters where I am stationed is over in Rockville, Maryland, way over here on the East Coast side, okay? And so that is one way that we have within our healthcare system and this health system organization to communicate back to tribes and to area offices. So simply the background of the CHR program, I told you that we were 53 years old this year. We have authority under the Indian Healthcare Improvement Act and the Snyder Act. And so those are important policy, I would say, mechanisms that provide and I would say more importantly, they secure funding for programs such as the CHRs. And as the CHR program started, and it's pretty much been accepted that the CHR program started in 1968, but it really was set up as a very unique way to provide health care, health promotion, and disease prevention services using outreach and the home visit. And so as we move forward from this time out, we're still keeping with that, but we also know we're expanding, okay, to include care coordination, more of the case management piece, the navigation component, absolutely. And so actually when I thought about this, CHRs really were, back in the day, the first entry point into a health career field, really investing in, I would say, local community people, training with health knowledge and skills, and then setting in place this path for workforce development. And so one of the other things I already said was the way that CHRs reflect communities. And I saw that even when I was new coming into Indian country in Tuba City, I was in awe of how, and I'm sure that as promotoras and community health workers, you see that within yourself. And that is something that's very powerful, where you have that lived experience and you're working within your community, within your neighborhood. So now I'm going to keep moving on. This is just simply who we are and what we do as CHR programs across our healthcare systems. And I'm not going to elaborate on it too much, but really one of the things that we try to do is identify what the health status is and what the unmet needs are in communities. And that is an entry point and a way for CHRs to align their work, their scope of work, their scope of practice. And again, how do we do that? Very similar to all of you in the field, through outreach, community education, the counseling component, social support and advocacy. And so that is that's what I would say brings us and really links us even as a strong field. Okay, so unfortunately, I did have a really cool video, but I wasn't able to show it, but it doesn't matter because I'm going to go ahead, and so if you have a chance, I want you to write this down. It's called A Day in the Life of a Community Health Representative, CHR, on the reservation. And when I came into this role last year, this was something that was referenced many times from allied partners that had really actually put this link onto their pages. And so I wanted to and just share this with you, that if you haven't ever been out to Indian country and you're not really sure what a CHR does, I want you to go ahead and find this on YouTube. If you just type in A Day in the Life of a Community Health Representative, you're going to come up with this image. And it was a video that was established and created by the Southwest Indian Relief Council. It's only, I think, a few years old, but it is a wonderful story of Kathy. She works on the Navajo reservation, and you see an opportunity for her. She's driving her truck down dirt roads that are not paved. These are dirt roads, just like you see in that picture. They're rutty, and it gets real rough out there on the res, you know, with, so you gotta have trucks. There is no, you know, a little sedan out there. You have to have four-wheel out there. And she's going out to 2 homes to go see 2 women, an elderly woman, 112 years old, and another woman. And you'll see here interacting and the type of health service provided, and you'll see how she interacts, how she's doing a home visit, care. So I really want to encourage you to watch this video when you have a chance, okay? And like it when you finish, and share it. Share it with your group if you can. So this is really, again, something that we within the CHR program, we take very seriously data. And this is important because data helps funding levels, it helps secure and establish, I would say, position. And so this was something that I researched in our CHR Data Mart, that I did a search on what are the types and the top services provided during the calendar year 2019. And obviously, I also looked at 2020, of course, that's when COVID hit, and we actually were half of our services. So we have, in 2019, CHRs provided over 780,000 healthcare services. And our top 2 health conditions were diabetes and hypertension. And they went in and they provided these health services through what you see on the left-hand side, through screening, providing health education, providing patient care, blood pressure checks, case management, monitoring the patient, transporting, doing some interpretation, translating, and doing these home checks. Well, we call them environmental service checks. You know, assessing the inside and the outside of a home for safety. So this is something that we report out each year, annually, as we report out on, and we actually ask for funding. Every program does this, but these are I would say, clinical indicators that we have as the CHR program. So this simply is just it sharing that the CHRs are very integrated into what we call our IHS strategic plan. And so again, one of the main things is that second bullet is to ensure through the CHR program that we help support goal 1. And goal 1 is contributing to very comprehensive, culturally appropriate, let me see, there you go, personal and public health services that are available and accessible for American Indian and Alaska Native people. That is where we nest. We really hunker down, and that is where our work is. Okay, I'm going to move through that, but I want to just talk about now and move into this impact of COVID-19. And as I was looking at the agenda of day 1 and day 2, a lot of the presentations were centered and focused on this. So I thought, okay, let's go ahead and share, the impact of COVID-19 in tribal communities. And so here is really probably the most telling impact that we saw as COVID hit. That, and you've heard this, that it really amplified and it made extremely visible environments, neighborhoods, and communities that were very resource limited. And so in the world of CHRs, that's the world that we work in. And so we saw, just gaps of us as a healthcare system being able to meet the need medically. We had challenges with, we call it surveillance, shortages with medical equipment. We also started to see this unequal access, and it's really different when you have a pandemic kind of spotlighted on you, because for the most part, this is just how we work in Indian country. We know we have to travel far distances to health facilities. And sometimes, you kind of get used to that. You just go, well, that's just how it is. But when your community is faced with this pandemic that really was life-threatening, and it was, high mortality, that's when you now start to kind of stop and go, hey, this really is something that is a disparity and inequity in terms of access to health services. We really saw this gap with health workers and I mean nurses, providers, additional CHRs, where we couldn't really step into that full capacity to provide service for our communities. But I also want to say too, and this is, I appreciate the Biden administration and Dr. Nunez-Smith's role with health equity across the United States within the Biden administration, because I think we need to have that strong leadership, that knowledge. I think that's what I so appreciate about the National Association for Community Health Workers, that you are calling out and raising the flag and the awareness around this, the impact of these socio determinants of health and these very structural factors. So, and one of them simply within Indian communities, and when I saw this firsthand, I couldn't believe my eyes when I first came into Indian country, was that it was water, and how people had to still go to like a community or distribution place just to fill up water jugs, big tanks of water in the back of their trucks, and to take it out to their home environments because there was no running water, no indoor plumbing. And so when you have something like a pandemic, like what we are going through, that just really makes it even more visible. Okay, so so this now is the impact, and I came across this article from Victoria O'Keeffe and Melissa Walls, and if you Google "How We Rise," they really uncovered in their article the impact on Indigenous nations. And I said, you know, this sums it up, and I really want to share this with you. That so if I would say the impact of COVID on Indigenous nations really is the loss of elders. And that is so, again, once we lose those elders in Native communities, we lose something more profound, it leaves a hole. And so when we lose those elders, they are taking that wisdom, their status as these cultural knowledge and language keepers. And that is something that we see and we saw. And so what happens, you know, I want to just say that part of Indian country and tribes, it's the language that that really creates a very, I would say, connection. I'm going to just go off my words here. To ancestors, to relatives, and to moving forward generations. And so what happens with language is when tribes lose language, they're losing a part of their identity and how they walk in the world. And so that's the impact with COVID-19 when we lose an elder due to COVID-19 that didn't need to happen. And so, but there's a positive story out of this, and you'll see this down the road in terms of actual data within Indian country in terms of vaccinations, okay? And so this was something that I also came across, this quote, and it's from a Carrie Hawk Lessard, and they are the executive director of the Baltimore and Boston-based Urban Indian Health Program. And as I was researching and looking, this stood out, and I just said, oh, this really resonates. And so what I found when we were in the throes of COVID last year, starting in March, I mean, you could hear us from an IHS side with healthcare trying to create, you know, good guidance, technical guidance, how to translate science. But what you also heard on the other side in communities, in Indian country, was this statement that the language you hear throughout Indian country is be a good relative. Do this for the grandmas. Do this for the ceremony. Do this for the language, because our people are precious. We already lost a lot. We can't afford to lose more. And so this was the call to action for communities to move towards vaccination, to become vaccinated, to support social distancing during that beginning time frame when we needed to. This was how we set ourselves up to do what we needed to do, because it's the right thing to do, and it's a part of being a good relative across Indian country. So this is two images that have been shown many times. If you can see them on Google, you know, in newspapers and magazines, and this is really how it looks out in Indian country at times when, you know, we are using anything and everything to share, I would say, in terms of COVID-19, this is a rodeo stand. And so someone actually put up this poster because they knew that's where the traffic was going to be. People were going to be going to the rodeos. And so this community made a point to say this is a good strategic spot for us. The other one on the right-hand side is a way of promoting safe distancing and masking. And so you see the kind of this way of an elder man and an elder woman that so there's a lot of identity there in terms of this type of promotion with social distancing. So this is about now moving into, well, how are the CHR programs and how did we respond to COVID-19? And I want to say that one, they really, CHR programs stood up into their role as the trusted messenger, as the community educator, to step into any way that their healthcare system, their tribe, their community needed them to. In the very beginning, when I actually first came into my role, and I actually was in my role starting in February of last year, and then boom, COVID hits. And so you know how that was with all of you. It was a frenzy. And so it was no different at the headquarters level. And so what we really worked hard on was building knowledge and information out to our health programs. And so this was something that we did with the CHR program. We felt it was really important to provide current information, key information, high quality information. And so we partnered up with Johns Hopkins University, and we started to move into community prevention materials. We actually also we were working really hard to help translate CDC guidance documents in a cultural way. And we were busy on the front lines establishing links for CHR program managers to access information. And so when I say we, it's not only just the IHS headquarters program, but you saw this with many nonprofit Indian health, I would say, program partners. They were doing the same thing. We were all trying to help prepare CHRs to have very diverse messaging materials, guidance documents. And so one of the other things that we did was we developed 2 guidance documents for the virtual home visit. And we also provided some information about the role and response of CHRs, and we posted them on our website. And so we moved into then developing town halls and education sessions for CHRs and community health partners. And this was a really exciting time. We really had high attendance. I mean, we were averaging 100+ people per session, because there is just this need out there within our CHR community of where to learn the science information and how to translate that and how to apply it. And so one of the other exciting things that we did to help support CHR impact, I would say, was the partnership with the University of New Mexico. And they have a fabulous Project ECHO, I would say, program. And I'm going to give a big old shout out to Paige Menking. She was so instrumental in helping us as CHRs within this community health ECHO deliver these bi-monthly, I would say, tele-echos out to the field. And so we have our last 2 actually next week and then 2 weeks after. So we will have completed a full year of delivering every month 2 webinars. And what was really nice about this, I want to say, this was a time where we also reached down into the CHR field. And we actually had CHR programs like Hopi, I'm going to say White River CHR program, and then another big shout out to the Kokopah tribe, they CHR program. They were presenters, and they shared their best practices of how they actually impacted, I would say, infection control, health education, contact tracing out in communities. And so then lastly, I mean, we've moved into the springtime in 2021, and we established another new partnership with the Northwest Portland Area Indian Health Board. And this is where we moved into looking at CHR, CHW, health services around health topics. And we had, gosh, wonderful sessions around HIV, new updates, substance use disorder, let's see, LGBTQ health services, hepatitis C vaccine. So this really helped set, I would say, the stage for how CHRs really then became so innovative, and they actually then adapted down to their level what the need was. And I'm going to show you a little bit about that. I put this in here too, and it's 4 slides. I'm not going to go through it necessarily, but you know, when we think about this, because I get this, I get questions asked from our top leadership. Michelle, what do the CHRs do out there? And I always use these slides, and I put it into, you know, talking points for them. I'll tell you what they did out there. They went ahead under this prevent component. They carried out social media campaigns to promote social distancing. They were strong advocates for policies in that area. They worked in those communities around mental health, physical health, and resilience. They delivered food and medications to the elderly and other vulnerable residents. They made masks, just like we all made masks. My mom made masks for all of us because we couldn't get masks at one time. And so this is what they did in terms of this component area. We have this detection component, and they worked hard, they studied, and they learned what the signs and symptoms of COVID were. They helped to support staff hotlines run out of their hospitals, out of their program partner. They created new hotlines. And so they volunteered and stepped up. And they referred COVID-19 patients to nearest testing centers, and they organized transportation. And I hope that what you see here really also is what, if you were going to share what you did in your communities, I would see the same thing. And so in terms of treating for COVID-19, we called patients that were in self-isolation because we wanted to keep tabs on them in case those symptoms worsened. A lot of the CHRs provided moral support with people who had COVID. You know, sometimes we had elders who were home alone, or they were so remote out there, they didn't really have neighbors that could check on them. We went ahead and supported contact tracing, symptom reporting, and monitoring. And you're going to see this in a few slides down the road, how one of the CHR programs really took that, both of them, 2 programs. I'm going to continue forward, and in this recovery phase of COVID, as we're moving through it, what did the CHRs do? They assisted with coordination to support tribes and urban communities with healthcare services. And so that was an important piece, that second line, developing toolkits, being that hub, that link between health, social services. And they also really helped contribute, I would say, benchmarks. We saw this on the Navajo Nation, really in the state of Arizona, how CHRs really contributed to evaluation and outcomes with COVID-19, okay? So again, I talked about shared the best practices. That was really evident with that UNM Community Health ECHO. We had many CHR programs move into that realm, and that actually became, I would say, its own best practice, because we keep hearing around the United States how they're going to do that same type of delivery with actually two programs that we know of who've applied for the CDC grant around CHWs, and one of the components is the development of the of a tele-echo to share best practices with COVID practices. So, and then I would say, where are we now as a CHR? We're supporting that community vaccine outreach and messaging. And that is where now we have moved into with this next phase, currently where we're at with COVID-19. So this is something that I wanted to share. I'm giving a big shout out to the Hopi Community Health Representative Program. They really are a powerhouse CHR program. And they work in an area in northern Arizona of situated on these hilltops, and they're called mesas up here on the left-hand side. Excuse me. And first mesa, second mesa, and third mesa. And again, if you have a chance to drive through, try to do that. It's just an amazing opportunity. But they deliver CHR services across 12 villages. And I am not going to attempt to say the names of these villages because I do get in trouble. I'll give them a new name if I try to use my dialect on it. But you see over here on the right-hand side, this is one of the Hopi CHRs performing COVID, I think it's testing services, supporting that component. And what's really important about this was the opportunities that I would say actually COVID-19 helped to bring out to our CHR programs. And we see this with publications. Here's an example of one where the Hopi tribe actually collaborated with the Hopi Healthcare Center and the CDC. They were called out to help design and implement ways to enhance COVID-19 case findings. And so really what came out of this, I would say, partnership when the CDC came out was this new program that is identified as, I'm going to call it CAC, CHAC, and it's around community outreach, health education, assessment for COVID-19, and connection to testing and care. And so if you have a chance, just Google again this. It's open sourced. It's on, you can do a search and find it, but it tells the story of how CAC was implemented within the CHR program and how it was rolled out and the impact that these Hopi CHRs had. Okay, so then let me see, sorry. I'm hitting the advanced button. So with that then, now we're just gonna move into this COVID-19 vaccination piece. And I thought it would be important so you could see as the Indian Health Service where we are. And so one of the things that we have is this community immunity. And that is something that we are very intentional. Everything we are trying to do now is to really connect back to the community so we have full immunity. And so we really are making very good progress with that. And I'm going to show you this actual slide right here. And this is current data. It's only 1 day old. It goes from December 14th, 2020 up to yesterday, July 28th, 2021. And it's actually comes from the CDC, and it's part of this new COVID-19 vaccine data tracker. And when you are able to access this on the CDC website, it will let you see where you are in terms of vaccination with 1 dose and being fully vaccinated by race and ethnicity. And so as we have these strong conversations around health disparities that are sometimes driven and many times driven by race and ethnicity, I was amazed when I saw our own American Indian Alaska Native numbers. And I wouldn't have expected this. But what you see here, and I had to, I did ask our vaccine task force deputy lead about this because she's the one who shared this with me. That I said, oh my gosh, we are the highest in terms of reporting out by race and ethnicity, being at least vaccinated with 1 dose or fully vaccinated. And so you can see this on the left-hand side when you can, I'm not gonna go through it, but we're up there. And I have to look at that, and I have to kind of say, that takes me back to possibly how an Indian country, when COVID hit, and we were in the throes of losing elders and loved ones, we just weren't going to accept that. We weren't going to say that is something that we were going to stop that. And so I think that we were able to turn the tide on that. Out of this, knowing who we are as Indian people, knowing that we need to get vaccinated because we are good relatives, knowing that we're in this together and we need to pull together. Tribes pulled together, healthcare systems pulled together, teams pulled together. That's why that number is high right there with 1 dose and fully vaccinated. And that to me is power. I think that is place, and I think it's claiming. So we really moved into that, saving our people. So one of the other things that is important with where we are with CHRs, with vaccine messaging, building confidence across communities, really revolves around public education. And so this is something that we are very proud to be part of. It's part of our public education campaign. And it is actually a resource kit for tribal leaders, many fact sheets. But this is how we roll in Indian country. We indigenize. And so you will see a lot of our messaging around imagery with land and I would say color and just design, okay? And so this is something too that we have on our website that supports this getting vaccinated component, this community immunity piece. We have them as COVID-19 confidence materials. And so they're all downloadable, they're customizable. You can put your own tribal healthcare center name or your CHR program name if you choose to do so. And so on the left-hand side are just two examples. And so you can see that the one in the middle represents, I think it's the Northwest, I could get this wrong, but we have the Southwest, the Northwest, more of the coastal side of these images. And so also the Delta variant. And so we have heard much about the Delta variant and how dangerous it is and how contagious it is. And so we actually love all the work that Johns Hopkins does. And this is just one infographic that I wanted to just share with you all, that if you have a chance, go to their website, Johns Hopkins University Center for American Indian Health. They are doing fabulous work with community preventive messaging. And so this is another way that we help support our CHRs with staying current with information, because that's so important when you go out into the community. And so this now leads us into this strengthening tribal communities piece. And so one of the ways that we have been strengthened really within our own CHR work with COVID has been with two funding mechanisms. And the first one was that CARES Act funding. And so much of the information that I shared with you around our town halls, our collaboration with JHU, our education sessions, our UNM teleechos, that was all due to funding that we were able to move and have so that we could develop these essential mechanisms to help support CHR and community health partner skills, knowledge, and capacity. What's very exciting is with the Biden administration is the American Rescue Plan Act and their commitment to public health workforce activities and development. And so that is our second, I would say, stream for CHRs. And so this really, it's all public information here on our IHS website. And so this is a snapshot of IHS putting out a press release. It's actually June 16th, so it's pretty current, in terms of announcing this opportunity for, and I just put in this section of public health workforce activities. And so I so appreciate the advocacy and the way that NACHW, and especially your leadership, Denise, really has had in keeping these funding opportunities very visible out in, I would say, the many different paths or settings is, and so I rely on your good work. I rely on your strong work. I rely on how you help actually us, even as CHRs, understand so that we are part of the rollout. And so really what we have done is IHS, when I say we have 240 million allocated for public health workforce activities. I have actually had meetings with our leadership about a lot of that now is we distributed over 200 plus million out to tribes already. And that already has happened for tribes to use for their investment in public health workforce. And that does include CHRs. Now, this is something that is very different with, I would say, us as the Indian Health Service, when we have a tribe take program shares, or they choose to, it's called become a Title I or a Title V recipient, where they're managing their own health or their own CHR program. And so that is an important piece that I think I need to mention, because it supports tribal autonomy and it supports tribal self-determination. And that's what we really want. So what does that mean for us with IHS? That just means that now we've become partners with tribes. And we know that we walk alongside, we're not out leading, and we are there to help support through technical assistance, through guidance as needed. And so now what we have as a CHR national program is an opportunity to use and submit, because the agency dollars that are left at IHS really now are kind of this larger public health workforce piece. And so I wanted to share with you some of the things that we are going to work really hard to try to set in as pilots. And one of the things, and this all is around using public health workforce activity funding through the mechanism of leftover dollars at the headquarters level versus out at the field, where I would say 80% of those funds are already there. But we want to, as a CHR program, identify and fund pilot sites that focus on health impacts. And that's really important for us as a CHR program, as an Indian Health Service organization. But we really want to bring it back to the CHR program around how we provide, I would say, programs and services in the home and the community-based setting. But we also really now are focused on this broader public health, social determinative health impact, and changing the context. And for those of you who know the CDC health impact pyramid, this is where this thinking comes from me, that up at the top. So when I say health impact, I'm looking at how we as CHR programs make the greatest impact over the population, over the community, versus more individual impact that happens within the four walls of the healthcare setting. And so I don't know what you all are going with as a CHW field, but we are going here, not fully and unilaterally, but we are going in this direction. And so I would also like to see us assess our CHR programs. And we actually have 284 CHR programs across all of those regional areas that you saw. And so I think it would be really important to look at and hear from them what they thought were strengths and gaps of their own CHR program and their connection into that healthcare system as COVID happened, because that's going to give us lots of good information as a national program, because quite honestly, I mean, I would like for COVID-19 to be over, I mean, today, but we don't know what's really going to happen or how long this is going to go. And we don't know if there's going to be another type of pandemic, but we want to be ready in case there is. And so then one of the other things is to assess and identify and support CHR training and certification. And I really am saying, because there's a lot of energy and a lot of great opportunity that's happening across states with CHW certification. And I hear, you know, CHRs, especially in the state of Arizona and New Mexico, they are moving forward and just really blazing a trail in terms of making sure that that is a priority. And so we want to, as a national program, how do we help support that across Indian country? And we also want to learn how to understand and figure out this reimbursement with Medicaid. As I've heard and I've read many of you write about in your research and I've watched your webinars on this. And so, yes, I think we want to understand how to leverage Medicaid and all of the SPAs and those 1115 waivers, those innovation projects. Well, how can we do that within CHRs in tribal communities, in our health cares? That's what we want to learn. Because I think that, again, leads to actual sustainability with a program. And then I can't help but also like to continue the use of tele echoes for our community CHRs, because that's such a fabulous platform to, one, just have them move into this leadership role, this facilitation role, where they become peer learners with each other, just because they've moved into wanting to share their story with a larger audience. Okay, so what's on the horizon? You might have thought, well, gosh, Michelle, didn't you just tell us what was on the horizon? Yes, that was using COVID American Rescue funding. But what's on the horizon for us as a program in terms of how we're evolving? This picture to me, this image, this is where we're going. It's holistic, cultural. It brings in, I would say, this interconnection, the connectedness, the relational. It's these indigenous ways of knowing around health, our role within tribes, who we are as Native people, our roles within our families, with relations, being a good relative, okay, and really our physical health. So this is where we're going. And one of the other things is very exciting is this national health coaching pilot that.
Hey, Michelle. I apologize. I want to quick interrupt real quick. We actually have our other sessions are starting, and I just wanted to let you know that we do have a few attendees that are dropping, and just kind of let you know the situation. Not a big deal, but just kind of where we're at. So
Okay. Thank you.
Yep.
This is just health. We're going towards health coaching. And so we already have a contract. CHRs are moving towards integrating the coach approach into their programs. That's what this really is about. And then this is just additional stuff. I'm not going to go to it. But I really want to say, lastly, if you're still here, you know, a lot of the important things that we have and are able to do as a national CHR program really comes from a lot of the important work that's happened in Arizona with the ASCHW group, with the Arizona Advisory Council on Indian Healthcare, and with this Northern Arizona CHR, I would say, equity program. And so I have shamelessly embraced what they have put forward as workforce recommendations on behalf of the CHR field. And so I want to say thank you. And this is one of the things as a national program that I'm really advocating for. Data reporting, acceptance of CHRs by healthcare teams, integration of CHRs, a mechanism of reimbursement through Medicaid, and establishing a formal mechanism with communication. If it wasn't for them, I mean, you know, we really would be behind, but I'm so grateful and appreciative of them. And then this is just lastly, letting you know who our partners are. And then I wanted to a special acknowledgement of that Arizona AHEC group, Johns Hopkins, University of New Mexico, Dr. Sabo. And then lastly, if you can go on to Facebook, search Facebook, Hopi CHRs, you're gonna see them. They are moving, man, like just fast and furious, using social media to announce and promote CHR COVID-19 activities, health promotion events. I just think that I really wanted to give them a little special recognition. And with that, that's it. And I appreciate it. I'm not sure if anyone is left on the call, but thank you so much. Have a great rest of the day. Thank you, Denise, your team, and it's a pleasure to have had this opportunity. So with that, have a great rest of the conference. Stay safe.
Thank you so much, Michelle. We appreciate your time and the excellent presentation and all of the information. To all of our attendees, thank you so much for staying with us. Your workshops are now starting, and so I'm going to invite you to visit your personal webpage that you may have used yesterday for day one. On that webpage, if you click on day 2 and you scroll down, you'll see the first set of workshops. We've got 5 workshops right now that are just beginning. You can click in and out of them if you want to visit more than one. And those workshops will last for 1 hour, and then we'll have a 10-minute break. Michelle, thank you for just elevating and centering the expertise of CHRs, their critical response and life-saving service during the pandemic, and also all the things that you and your team around the country are doing and thinking about to sustain and respect and protect this workforce. It was great to meet you last fall, and I look forward to continued partnership. Thank you for your gracious words. I want to thank our conference co-chair, Ramona Dillard, for making this session possible and making sure that we elevate all of the members of our very diverse workforce, including CHRs. Thanks, everyone. Have a wonderful rest of the conference, and we will see you after the workshops for our closing session. Take care.